Welcome to There's No Place Like Home, the radio show coming to you on WRXB 1590 AM and Pinellas County Connection TV. This program is presented to you as an opportunity to hear information that can help you fulfill the dream of owning your very own home. We also share information about upcoming special events and programs to help you enjoy the good life in Pinellas County, as well as other items of interest. The sponsor of this program is the Housing Finance Authority of Pinellas County, which offers the First-Time Homebuyers Program, your key to home ownership, helping people in Pinellas, Pasco, and Polk counties make their dreams of home ownership a reality. I'm Frank Bowman, alongside Jane Merlin, your host for today's show. Good morning, Jane. How are you?
I'm doing great, and how about yourself?
I'm doing very, very well. I'm kind of enjoying the summer, which is not usually the case for me, but it's pretty good so far.
We're off to a pretty good start, although I have to say we had a little bit of a scare with our first tropical storm early on, and I hope that everybody was ready. You know, we had our hurricane preparedness show last month, and I'm hopeful that a lot of people really paid attention and were actually ready to weather the storm.
That's true, and of course the thing came in right on cue. The season started and the storm started at the same time.
Exactly. Well, I'm really excited about today's show. I think this is going to be very interesting and informative for people. And before we get into it, I want to read a quote that I found that I think is very pertinent to the topic. We can make a commitment to promote vegetables and fruits and whole grains on every part of every menu. We can make portion sizes smaller and emphasize quality over quantity. And we can help create a culture, imagine this, where our kids ask for healthy options instead of resisting them. Now, Frank, I know that you saw the notes already for the program and everything, but as you read that, did you have any idea who said it?
I did not know who the quote was from, but I did totally agree with it. It's a direction that as a nation we really need to move toward.
Well, and speaking of the nation, that of course brings me to who said that, and that was First Lady Michelle Obama.
That makes sense. Yes.
Yes, it does, and you know she's been a very vocal and prominent figure in trying to instill good health and especially as it relates to nutrition for children and families. And the reason I selected that particular quote, I think, is going to become clear as we move into our conversation when we are going to hear about a community health assessment that was conducted by the Florida Department of Health in Pinellas County. And it provides a lot of great insight into some of the key factors that affect the health of our community, and even some steps that we can hopefully all take to improve our own health. And Frank, I know that you've got an update from our sponsor, the Housing Finance Authority, before we actually get into today's topic.
That is very true. The HFA is offering the First-Time Homebuyer Program for individuals in Pinellas, Pasco, and Polk counties who have never owned a home, have not owned a home in the last 3 years, or who are veterans. The HFA offers a low rate on its 30-year fixed-rate mortgage, and if you need a little help with down payment and closing costs, they can help you with that as well with the Home Key Second Mortgage, also available in Pinellas, Pasco, and Polk counties. To get your key to home ownership, call 727-464-8210 or visit our website at www.pinellascounty.org/community/HFA. And by the way, to reach us for more information or comments about this show, call us at that same number, 727-464-8210, or email us at housingfinanceauthority@pinellascounty.org. Remember, you can also catch past shows by logging on to the website, and you can even catch us on YouTube. Jane?
Thank you, Frank. That is great information. And certainly one of the things we want to do is make sure that people are happy and healthy in their homes. And I'm very hopeful that today's show will really help people become better informed and on how to do that.
Excellent.
So it's my pleasure at this time to introduce our very special guest, Rebecca Phillips. She's the Health Equity Officer and Community Liaison with the Office of Performance and Quality Improvement with the Florida Department of Health in Pinellas County. Rebecca's going to provide us an overview of the community health assessment that I mentioned earlier and how it affects Pinellas County. Welcome to There's No Place Like Home, Rebecca.
Good morning, Jane and Frank. Thank you for having me. Glad to be here.
Oh, and we're delighted to have you here and very interested in speaking with you about the assessment and everything.
Yes.
However, before we get into that, I think it's really important for us to get a better understanding about your department and what you all do, because many people tuning in might not really be aware of what your organization does.
Absolutely. Well, the Pinellas County, or the Florida Department of Health in Pinellas County, we're responsible for the overall health of the community, Pinellas County community. If you think about going into your own doctor office where your doctor is responsible for your health, your individual health, well, the health department is responsible for the health of the community at large. So when you think about what we do, we provide immunizations for children and even people that are coming into the country or leaving the country. We provide emergency preparedness and disaster preparedness, getting ready for the hurricane season. And just in case there is a storm or something, we're there to help. And by being in the shelters and different things, we provide dental care, primary care. We provide a number of services and things that breast cancer screenings and those sorts of things through voucher programs. So we look at the overall health of people, but also how a personal health can also impact community health. So you think about it, we have probably just under 1 million patients when you think about Pinellas County as a whole. So the health department is here just to make sure that our community stays healthy.
And now, how does that work? You have offices that people can go to for these services?
Absolutely. We have 6 locations, which we're very fortunate as a county because we're from the south end to the north end of the county. So we have a center in Tarpon Springs. We have one in Largo. Our Mid-County Center is over on Omerton Road as well, and it's one of our newest centers, beautiful facility. We also are positioned in Pinellas Park and in St. Petersburg, and we're here in Clearwater where we just opened up our facility that had been renovated. We opened back up back in January. So we're always looking to support the community and their needs, and so Clearwater went under a mass renovation just to make sure that we're able to provide the services that our ever-changing community needed.
Very good. Well, that's quite a lot of responsibility that your department has. And
Yes.
how do persons qualify to receive the assistance from you?
Well, there are a number of programs. I always encourage people to call in to the health department and to find out what services they qualify for. We do a number of services in conjunction with Health and Human Services here in the county and the community health centers as well. So there's a number of primary care services they may qualify for. Also some behavioral health services as well that may not be provided directly within the health department, but through some of our partnerships. So it's best that they call in if they need those kind of services. Of course, if you need things like birth certificates or death certificates or things, you can always go into the health department. Dental services and those sorts of things, they definitely need just to call in. And there's a number of programs that people may qualify for. So although you may not qualify for one, you may, definitely qualify for another. So there's plenty of options we have available.
Very good. And how can people reach you? Do you have a main phone number or website that you can give?
Yes. So we're at PinellasHealth.com, and you can also reach us by calling 727-824-6900.
All right.
That's very good. And most of these services are provided free of cost or like a sliding scale or?
Some of the service may be provided at free of cost. Others are on sliding fee scale.
Okay.
Of course, if we can't provide services, that's when we look for our community partners that may be able to provide some services free of charge.
And you mentioned earlier, this is actually a state agency.
This is a state agency.
So the state has health department facilities throughout the state of Florida.
Yes.
It sounds like we're fortunate to have as many locations as we do here in Pinellas.
We're definitely fortunate because we are one of the larger counties, and so we're one that is fortunate to have centers all through the county where we try to be accessible. And as we go into the community health assessment, we'll talk a little bit about access to care and how much of a difference that makes when you're trying to prevent chronic diseases and those things.
Well, that's a perfect segue to get right into our one of our main focuses today, and that is the community health assessment that was conducted, and there was actually a survey that went along with that. Tell us a little bit about the assessment program and the survey and some of the findings that you had.
The assessment process actually was quite lengthy, and it's not something that is done typically in a matter of weeks. We've been working on completing the community health assessment really since back in 2011. So it's done through several different phases, and what we use to complete the community health assessment is what we call a MAP process, which is mobilizing for action through planning and partnerships. And with that, there are like 4 different assessments that go through the process of then pushing us towards completing the community health survey. So, for example, some of the processes we go through the organizing and the visioning process, and then the actual assessments themselves, which would be the community themes and strength, local public health system assessment, the community health status assessment, and then finally the forces of change assessment. And so that's where the community health survey and those things came through as a part of that community health assessment. So back in 2011, we started with completing the local public health system assessment. In May of 2012, that's when we moved in completing our themes and strength assessment, and we also worked on our community health status assessment and the forces of change assessment. And this is indeed a community endeavor. So we have multiple community partnership or stakeholders in the community to come in and actually help us complete the assessment. We're fortunate that in our May, we went to the collaborative labs, and we were able to pull in more than 60 of our community partners from various agencies around Pinellas County to help us start this tedious work in making sure we had a full community health assessment.
So the assessment process spoke with service providers who are out there every day working with citizens. Did you also have a component that surveyed individual citizens and their needs and uses of the facilities? Or?
Absolutely. What we did when we got to the community health status part, we decided we really needed to know what our citizens what they're saying, because we realize that although we have an idea, we have the statistics and the facts that says this is what's really going on in the county, sometimes the perception of the community is definitely different. Mm-hmm. And then it's according on what area you live in, what your need may be. So we started off looking at the survey, hoping to perhaps get about 300 or so folks to complete the survey. We had over 840 something folks to complete the survey, and the survey was disseminated from south to north Pinellas County. We had numerous community partners to have the survey in their agencies and organizations for people to fill out. We had people in the health centers that would come in for their checkups or their visits to complete the survey as well. So we had a very diverse group of respondents, which we believe led us to great results, very significant results in this survey.
Well, what were some of the main results or findings in the survey, and did you find anything that was surprising?
There were a number of surprises in the survey. One of the things that was really nice that the survey revealed is that most people that live in the county are very pleased with the county that they live in. They feel safe in the county. They feel that their neighborhoods are a great place to raise their children. And when you start thinking about personal health, that's very significant, because when you don't feel safe or when you feel that your neighborhood may be dangerous, that oftentimes impacts mental health. That impacts how people will, whether they'll go outside and exercise or walk around their community or not. So that was good for us to be able to know that people really felt good about where they lived. Some of the surprises of the survey was the fact that addiction was one of the number one issues that people really felt was a concern in our community. Now, as a health department, we often think of some of the chronic diseases such as cardiovascular, diabetes, and those sorts of things, or some of the communicable diseases such as STDs or for example, H1N1 when that was an issue. But people looked at addiction as being a major issue, the number one issue of concern when we start thinking about a healthy community.
And what were the addictions? Was it I know we've been reading a lot about prescription drug addiction, or was it something beyond that?
Yes, definitely looking at any of the substances that would cause abuse, and also alcohol. So those were the primary ones that people were looking at. And the prescription drug issue may have led to it. The survey did not identify specifically that prescription drugs was the number one, but we do know that that is a major issue in the county. And so we believe that that may have also been one of the things that have enlightened people that make them really start paying attention to addiction issues in the county.
I can see that. If you're looking, when you think of health, you think of your physical body and problems you might have, but this survey looked at the health of the community and the health of neighborhoods. I would think that addiction causes problems for the people that have an addiction, causes problems for the people in their families, but it also has an impact on the community they live in as well.
Right, and that's the really good thing about the survey in itself, because the survey is revealing about community and individual. And what we're really trying to impress upon the people of Pinellas County is that your individual health does have a community impact. So whether it's addiction, maybe it's domestic violence, those things do cause issues and problems within our community. Even the communicable diseases, the rate at whether a person has insurance and being able to get their own individual doctors or not, or having to go to the emergency room to utilize the emergency room as their private doctor, which we are really working towards eliminating that. But what we really would like is to see people be able to have their own doctors so that they are using the emergency room, because we know that ongoing care is better than going in for that sporadic care in the emergency room. And it's not the best ways to utilize the services and finances of the community as well.
And I suppose a lot of people wait until their situation is almost to a dire extreme before they actually go in and get the care, and results in them going to the ER. And so if they had access sooner, perhaps they could have treated that health condition or issue and before it got beyond.
Absolutely. I mean, even when you think of something as simple as maybe a dental problem, a cavity that then grows into an abscess, and if the person has no dental care coverage or don't have a doctor, then they end up going into the emergency room just so they can get a prescription of some antibiotics or pain pills or something. But then they never can follow up to even have the abscess or that tooth removed or whatever care they may need. So it continues to be an ongoing issue. And before you know it, the person has established quite a cycle of going into the ER for whatever care they may need concerning that problem.
Well, the quote that Jane gave us from First Lady earlier speaks to, I guess, what the health department probably thinks is a very important component, which is prevention.
Absolutely.
And what did the survey results point out that we need to do in terms of prevention for health issues?
Yes. Well, one of the second issues of concern of the community is obesity, nutrition, access to nutrition, great nutrition and healthy nutrition. And a lot of what we know is that when people can't exercise or get out and exercise, or when there's not the availability of healthy food choices or options for whatever reasons, that oftentimes people, those folks are subjected to certain health issues. So when you start thinking about your high blood pressure that then leads to heart disease and chronic heart failure and those sort of things, then we then look at a person that may have been able to prevent the congestive heart failure or heart disease if their diet was different. So we're really looking at prevention and the impact that it has on the community when we think about financially, when we think about how a person is then able to get out and enjoy their community and also then contribute to their community.
We were talking before we went on air about the fact that it is often less expensive for families to make choices at fast food restaurants,
right,
rather than perhaps being able to go to a market or what have you and purchase fresh produce. And we also talked about the fact that some folks aren't really cooking anymore. So with all of this knowledge, what do we do to fix some of these things and turn some of these things back around?
Right. Education is definitely the key. We have to start informing people about healthy food choices, but then we also have to create access to those healthier choices. So it's one thing to have a particular fast food restaurant in the area, and you have all these wonderful dollar menus these days that makes it kind of easy to pull up and order whatever you may want from that menu. However, teaching a person then how to go into a grocery store and shopping for vegetables and produce and looking at how they're spending and how they have to change their way of thinking when it comes to spending money on those healthier options. Now, it's not as easy as it seems for some, because it is really trying to teach people how to rethink about what's healthy nutrition and then the cost savings, not maybe in the immediate, but in the long term. Mm-hmm. So when you start thinking more about buying some of your vegetables and being able to help a person be a little more healthier because they are eating those servings of vegetables that they need, they're eating the right things, we can look at it and know that it may be a cost investment on the front end, but it's definitely saving people later on. It's saving lives later on.
Does the health department provide instruction or classes, or do you guys coordinate with our county extension? We've had guests on here from Extension talking about some of these issues.
Well, we coordinate with a number of different agencies, but we also offer the WIC program, which is Women's, Infant, and Children, that is nutrition based. They're going to teach people nutrition and how to make the most for whatever the checks is that they may get each month. They're going to make sure that those women know how to prepare foods and how to shop for the healthiest food options for their children. Now, all of those things are great. One thing that we have been also looking at through the Community Putting Preventions to Work and some of our other partners in the area is looking at, are there any food deserts in our area? Those food deserts are places where there may not be the major grocery stores in the community. So if people can't actually get to the grocery stores and things, and then you think about a family of 4 or 5 having to carry groceries maybe onto a bus and riding for hours on the bus or different things to get home, and then you can only put so much in a shopping cart that's not going to maybe spoil on the way home. So we're looking at food deserts, and although our county is really in good shape when it comes to making sure that there are certain stores and things in the area, there aren't always the major grocery stores. So some of those healthier options are still not in the communities that we need for them to be in. And so that's why you're seeing some of the rising. We have a new farmers market here in Clearwater, and that was an effort of the Community Putting Preventions to Work and the health department. And also the Hispanic Outreach Center have been very, very helpful in making sure that that market happens. So we're looking at making sure that we have those farmer markets available. And then what they've done, even in those farmers market, is for people that use the EBT, they've doubled dollars. So you can go and spend $10 on your vegetables and they'll double it, where you then get $20 worth of food. So those are the things that are really helping people and are very practical, where people are saying, well, you're not only telling me to do something, but you're also helping me and assisting me and making it happen so that my family can eat healthier.
And being able to provide the resources in order to do those things that you're talking about.
Absolutely, and that is definitely key.
So you've got the survey and the results are in, and you've got some very interesting findings. What are the next steps now?
Okay, so what we've been doing after we had the collaborative event last year, May of 2012, we also did a little survey and asked our partners that were there, will you help us with the next phase? And of course, most of our partners were definitely on board and helping us. And so from there, we created what is now known as the Community Health Action Team. The Community Health Action Team became responsible for then putting together and developing our Community Health Improvement Plan. Because what happens from the Community Health Assessment, there is so much information that the community has now told us, either through our statistics and our facts and or through the community survey. Now we have to look at those things and say, develop an action plan, and how do we now address those issues? So the Community Health Action Team put together the Community Health Improvement Plan, and they looked at what the survey suggested that we really start exploring. And there was 4 strategic priority areas that the community requested that we looked at. Those areas is access to care, behavioral health, healthy communities and environment, and also health promotion and prevention. So those were the areas now that we have developed goals and strategies in. And so our next step from here now is even developing the action plan, and then we're looking for implementation. So probably, May, just a few weeks ago, just a couple of weeks ago, we brought together all our community partners again and sat down, and then we started looking at the action plan and activities that will help us get to fulfilling those goals that we need to in order to make Pinellas County a healthier place.
Well, this has been a very informative discussion, and we really commend you for the work that you're doing and trying to make us a better community, a healthier community.
Mm-hmm. We're definitely glad we're here, and we want people to know that you can go to the website, and actually there will be the community health assessment on there. The compilation was probably about 95 pages, so there's a lot of data and very specific information if you want to know more about what Pinellas County is saying regarding their health, and also what some of our findings and our statistics are suggesting, and places where we may need to move and improve. But we're really in good shape as a county, but there's some things that we definitely need to improve on.
Well, we've only got a couple of minutes left. Real quickly, go ahead and give that website again so people maybe can jot that down.
Okay, we're at www.pinellashealth.com, and please feel free. You can learn so much about the health department, a number of our divisions and areas, phone numbers, whatever you need to know is on that website. And we're also going to keep you up to date to prepare you for this hurricane season. And so if you need information about how to prepare those, that information is also on the website as well.
Excellent.
Well, this has just been very wonderful information. You've been awesome to join us today, and we'll definitely have to have you back because there's so much more that we could discuss, and we're going to want to get some updates along the way. So
absolutely, and we'll love to be here, and we'll be finished with the Community Health Improvement Plan by June 30th. So we would love to come back.
Well,
Excellent.
you're in. You're
Okay,
in.
great. Thank you.
We thank Rebecca Phillips with the Florida Department of Health in Pinellas County. And we also want to thank the folks with Pinellas County Communications Department and, of course, our friends at WRXB 1590 AM. Be sure to join us again next month, and don't forget to reach out to us if we can give you some additional information or provide us with any feedback. I'm Jane Merlin.
And I'm Frank Bowman.
Thanks for tuning in, and remember, there's no place like home.